Hello, my name is Jeff Peterson with Peterson Physical Therapy. I've been a physical therapist for 36 years, and we work with people of all ages, all types, and I did some calculations, and it's, in the tens of thousands of individuals across many treatments. Most of the people come to see us at Peterson Physical Therapy because they're in pain. So pain has become something that I've studied over the years, and it's something that can be really challenging. So the International Association for the Study of Pain identifies pain as an unpleasant emotional experience associated with actual or potential tissue damage. So you don't need tissue damage to have pain. And we did another video on this previously, but I want to review this, especially at this time, because many of us are starting to come out of lockdown. We've been less active maybe. We've not been eating as well. We've been under a lot of stress, either business stress, emotional stress, and pain can be increased by laying on your couch, watching the news, and absorbing all of that. And there's a lot going on. So I'm not going to talk necessarily about what's going on, but I want to look at the impact. So if you're in that position, welcome to the club, because my own family and people that we work with at home and at work are coming out of lockdown, and there's been a considerable amount of stress. So I want to review the idea of what pain is, and then I want to talk about some things that you can do to combat that or to deal with it. But the first thing is to have a sense of understanding. So if we look at pain perception is influenced by the physical. So that's what's happening at the level of the tissue. Is there a strain, a sprain, a laceration, a compression? The rational is that's what happens when you go to the doctor. He says, oh, it's just a small fracture. But if it's your radius that's fractured, that can be really emotional. And so all these things add together to create your pain perception. And your response to that can be emotional and is defined as an emotional response, even though there may be a physical cause. So I just want to talk to you about what happens in terms of a reflex. So let's say you have tissue trauma, you have tissue deformation. Deformation could be you have a compression of an area. If I'm working on the computer and my wrist is resting on the desk or my elbow on the chair and I compress either my ulnar nerve here or my median nerve, that's going to cause some tissue damage. If it's a vascular issue, you have decreased circulation because of diabetes. You might have pain memory. You had an injury years ago. Remember, the definition of pain is actual or potential tissue damage. If you've had tissue damage in the past, the memory of that, the neurological memory of that can come back, or neurosis. And that's not a judgmental term. Neurosis refers to just when the emotional system has been traumatized in some way and it doesn't know how to deal with pain. So any of these issues can create an input up to the central nervous system. And it goes right up to the limbic, right by the limbic system. The limbic system is the emotional center of the brain. And it gets processed, and then your brain takes information from the environment visually, auditorially, and says, okay, what's going on here? How do I perceive this pain? Let me give you an example of a tissue damage. Let's say you go to see your physician and you want a vitamin B12 shot. And he pulls out the vitamin B12 and he gives you an injection into your deltoid muscle. And it hurts a little bit, it's a little bit red, but it was something that you requested, it's something that's helpful. Your emotional experience is going to be one of, okay, it's a little bit red and it's a little bit uncomfortable. Now let's say that you're sitting here and we're entertaining a discussion on pain. And I pull out the same exact needle, and without your consent or awareness, I jab you in the bicep, or into the deltoid, in the same exact spot, creating the same exact physical deformation of tissue. You're going to have a completely different emotional experience. Because in one case, you were informed and you had consent. In the other case, you weren't informed and you had no consent and you've literally been assaulted. Those two conditions are going to create a different pain experience, even though the tissue deformation and trauma is exactly the same. So keep that in mind. And that's why it's important to be able to, as we start to move forward and start to get moving again and engaging with people, because the truth is, my belief is that this idea of new normal, we cannot live without engagement. I know at our practice, we engage with our patients and we're very physical and manual with them. So we're trying to traverse that. How do you do that? So as we start to do that more and more, and we start to identify areas that may be tight or weakened, or the circulation has been decreased and start to hurt, we want to be able to understand what's going on. So understanding pain is important, and then understanding yourself is important. So there are some things we can do. The first thing I would say is, if you have any pain that is new, or even if you've experienced it in the past and you have any questions, it's always good to go and see your physical therapist or your physician, because they can add the rational element to understanding what's going on. What we've learned in the past is the severity of the pain is not always directly correlated, or the intensity of the pain is not always directly correlated with the severity of the problem. There are some really painful conditions that are not serious in terms of life-threatening. They are serious in terms of decreasing your quality of life and your level of function, but they won't kill you. So it's important that you have somebody that can help you rationally look at the physical side of the pain, help temper the emotional side, relieve some of that tissue trauma, increase the circulation, and get you moving. And that's really the expertise that we have here with the physical therapist at Peterson Physical Therapy. So if you have any questions, we want you to come in. What we're going to do in the next video is actually talk about some steps that you can take to recognize and make some easy changes to hopefully decrease your level of pain so that improve the quality of your life. So I appreciate your time. Feel free to like our Facebook page, subscribe to our YouTube channel, and if ever have any questions, feel free to contact us.